is very interesting. All right, I think the only country in the world which will not be stressed about this question is Iceland, right? So I think they actually announced that Iceland is mosquito free. For the rest of the world, we have mosquitoes in them. So this question is more like we should discuss the type of care you give to a child who has malaria, who has become unconscious. Do you understand? So it's not just the normal malaria treatment. This one, you are dealing with a child that the child has actually become unconscious due to malaria. It's a very severe case, right? So the type of care you give to a child that has malaria that has actually become unconscious. So first of all, you should know that it should be treated as a medical emergency, and the care should be focused on the airways. That means the child is whatever is happening, you should make sure that that child is still breathing. Then of course, what is causing the loss of consciousness is malaria. So as you are doing other modalities, you should also be tackling the malaria small. Okay, then you should prevent complications like cerebral malaria, and you should always be checking for the vital functions of the child. So the first approach is the ABCD of resuscitation. So for A, you ensure that the airways are open. Okay, you place the child in a lateral position. Don't place them facing up. All right, place them in a lateral position. Okay, so if they are bringing out saliva, catarrh, try to suction it out. Remember the child is not conscious to be able to throw out saliva by themselves, so you have to use the suction. Then B is for breathing. You could actually put them on oxygen. Okay, so high flow oxygen, monitor respiration rate and oxygen saturation for that child. Then C is circulation. You can establish IV access, check pulse, check their blood pressures, check their capillary refill. Do you understand? Then check their skin turgor even, then if they are in shock, that's hypovolemic shock, because the malaria parasite actually breaks down the red blood cells. Do you understand? So they could be in shock, so you have to actually be giving all those IV fluids. So IV fluids like I think 0.9%, no, is it sodium chloride, right? Then you have the normal saline, you have the 10% dextrose, and the rest of them. So it's when the child is actually conscious, that's when you switch to the oral rehydration solution, that's the ORS. Then we have the immediate anti-malaria treatment, where you use all those anti-malaria drugs. Now remember, the child is unconscious. You can't be giving them drugs through the mouth. They can't take through the oral route. You have to actually find an alternative to get these drugs to the system of the baby. So it's actually the intravenous route of drug administration. So you give drugs like the intravenous artesunate. If artesunate is not available, you can give intravenous artemether or intravenous quinine. So continue the therapy for at least 24 hours. All right, so once the child comes up, once they are conscious again, you have to switch from the intravenous type of drugs to oral anti-malaria combination therapy. That's what they call the ACT. Okay, so essential investigations that you might do, you might need to do things like all those blood film, just to dictate, what do they call it, the malaria parasite. Okay, blood glucose, full blood count. You do electrolytes and renal function, lumbar puncture if you are suspecting that meningitis is there. Then you try to manage the complications, right? The child will be suffering from hypoglycemia, that's low glucose in the body, so you have to give 10% dextrose intravenously. All right, if they are suffering from seizures, you have to now bring your benzodiazepines. Okay, so you give drugs like diazepam, you give drugs like midazolam, you give drugs like phenobarbital. Then cerebral malaria, just make sure that they are breathing, put them on oxygen, treat seizures. That's just what we went around. Okay, Then if they are having anemia, of course you have to transfuse blood, and that should be packed red blood cells, because it's red blood cells they are needing. Okay, you understand? So those are the principles towards that. Then acidosis and shock is just oxygen fluids. Okay, renal failure, just keep monitoring the outputs. Then if it actually gets so severe, you have to place such a child on dialysis if available. Alright, so supportive care, maintain normal temperatures, prevent pressure sores. So if the baby is bedridden for a very long time, you have to be turning them, do you understand, so that one side is not on the pressure too much, you know. Insert a nasogastric tube for feeding. Remember, the child can't really, is weak, can't really feed through the oral route like that. Okay, maintain hydrations. Then if there's any infections, you have to treat the infections like pneumonia, sepsis, and the rest of them. So I think with this we have actually covered a lot on how to